In this article, radical belonging was discussed specifically in the school setting, but the thoughts and principles can be transferred to most other health settings, especially healthcare. The problem of racism in our country is deeply rooted, stemming back years, and entangled with the acts of colonialism, capitalism, ableism, and imperialism. With that being said, disabling racism will not be an easy feat. It involves exposing and rejecting all forms of oppression wherever they exist and whoever they involve. The article about race, ethnicity, and education offers a vision of what could be, using belonging as a starting point. This vision focuses on the necessity of a transformative change to root out the racism endemic in schooling, pointing out that the school community is a key unit of change. The essay emphasized that radical belonging is a communal experience stemming from a collective action, meaning that it has to be a mutual effort of all involved to successfully reach radical belonging. With this, there are essential aspects of radical belonging. These are social belonging, which is the ethos of critical care; academic belonging, which emphasizes that learning and feeling accepted are entangled and mutually enforced; cultural belonging; and lastly, democratic belonging, which is a resistance to systems of oppression. In summary, focusing on all these essential aspects will be a starting point moving towards the change of rooting out racism and focusing on radical belonging.
Sense of belonging in healthcare is key to having efficient and collaborative efforts and results within a team. It is imperative that each individual feels heard and understood in a safe, judgment-free working environment where no discrimination or disrespect is tolerated. Working towards belonging within the system will have a positive impact on the overall wellness of healthcare practitioners.
Our team has come up with several recommendations to support radical belonging at M Health Fairview. These recommendations are split between the organizational, team, and individual levels. First, we're going to take a look at the organizational change recommendations. These can be further split into short-term and long-term changes based upon the difficulty of implementation. The short-term goals include a non-discrimination, zero-tolerance policy. This will ensure the protection of all individuals' basic rights. Implicit bias training, which will help all professionals reflect and grow on implicit biases they may not have known were present. Professional awards, to reward those setting a good example. Mental health weeks, to improve morale within the workplace. Open forum monthly meetings, for individuals to bring about issues within the workplace. Anonymous suggestion boxes, to report issues within the workplace in a non-public environment. Provide clear guidelines for employee advancement opportunities so all individuals can advance within their profession as they aspire to. Next, long-term goals include an Office of Professional Oversight who can help sort out issues of professionalism within the workplace, increased access to therapy for providers to support and improve individual mental health, hiring more staff to decrease the work burden within the hospital, incentivizing extra shifts or filling in for coworkers to help with extra demand, maximizing PTO benefits so employees can have as much time off as possible, dedicating a budget toward mental health to increase resources to support employees, and lastly, employee daycare option to support those with children. Next, team change is mainly centered around creating an atmosphere of respect, inclusivity, and strong interprofessional relationships. Team change recommendations include supporting and hiring teams and leadership with diverse backgrounds, supplying leadership training to those with significant leadership roles, defining clear roles and expectations within each team, fostering an environment of respect and open communication within the team, and encouraging team building exercises to foster team chemistry. Lastly, individual change recommendations include practicing self-awareness within the workplace, increasing awareness of team member needs and helping out whenever possible, reflecting on implicit bias and growing within the individual, fostering professional relationships with colleagues at the workplace, supporting an environment of open communication, and lastly, participating in continuing education opportunities.
So why these specific recommendations? Well, we sat there and we brainstormed for quite a while on a handful of recommendations, but we chose the recommendations that we did because we believed that they focus on the inequitable impact of COVID-19 on marginalized communities and the related stressors for healthcare team members with marginalized identities. So while coming up with interventions and recommendations, we were trying to come up with things that we thought would be beneficial for most, if not all, healthcare professionals, but especially focusing on recommendations that would assist those of marginalized communities. For example, we believe that specific recommendations like our zero tolerance non-discrimination policy would help support those employees that may have been belittled in the past. Furthermore, some of our recommendations like implicit bias training, mental health weeks, an anonymous suggestion box for people to feel comfortable providing feedback, and self-awareness would help create a safe space for those with marginalized identities. We basically believed that these interventions would provide a judgment-free zone where members who didn't feel comfortable in the past could now feel comfortable kind of speaking up and sharing their thoughts and ideas. One of the main takeaways that I personally had while reading this case was that some of the employees stated that they didn't feel comfortable voicing their opinions, so they just ended up staying silent. So we wanted to eliminate this. We wanted to center our recommendations around safe and open communication. We ended up taking a look at the article that was provided to us through the IPTS webpage titled Disparate Impact of the COVID-19 Pandemic and Health Equity Data Gaps. This article said that racial and ethnic minorities were at a high risk of facing COVID-19 related stressors. It stated that children of a minority were more likely to lose their main or only caregivers to COVID-19. While keeping all of this information in mind, we kind of came up with our recommendation. This is why we put such an emphasis on certain interventions like an employee daycare option. The COVID-19 pandemic pretty much just flipped the lives of some individuals upside down. So providing simple measures like extra PTO benefits or childcare could really help those affected, marginalized individuals to get back on their feet. Additionally, we believed that these interventions focused on the stressors related to the COVID-19 pandemic because recommendations like increased access to therapy, staffing improvement, leadership training, and team building exercises would focus on eliminating burnout and making mental health a priority.
So now I'm going to talk about how we plan to implement our recommendations. We know that some of our recommendations and goals are ambitious. So in order to achieve them and ensure lasting change, we would implement them in succession, starting with our small, more attainable goals, such as the anonymous suggestion box or stating our non-discrimination policy, and scaling up to our more involved initiatives, such as building an office of professional oversight and hiring more employees. Before beginning the actual implementation process, we would create a timeline and a map out what goals and what initiatives we want to achieve when. By doing this, we will have deadlines to ensure that we are on track to making the changes we hope to make, and we will ensure that none of our initiatives are forgotten in the process. So that we don't blindside our employees with random changes to the workplace as well, we will begin the transition to implementing our recommendations with an announcement in the form of a meeting or an email out to all employees so that they are knowledgeable of the changes to come and so that they are aware of how to utilize the resources we will be implementing. Again, we will provide anonymous suggestion boxes and online forms for individuals to voice their concerns so that we can ensure the changes that we do make align with our employees' goals as well. Amidst these changes and initiatives, we think that it's necessary that all of our employees and new employees feel valued no matter what their background is, especially those who identify within a traditionally marginalized community. In order to make this happen, we need to ensure the culture of the hospital and the work environment reflects our values. So we will also require all employees to attend implicit bias training, and we'll ensure that a non-discrimination policy with a no tolerance policy is put in place. We want to make sure that all employees feel safe when coming to work, and when they do, this will help improve the culture and the environment of the workplace as well. With this non-discrimination policy, the hope is that people will feel safe to voice their concerns and opinions as well. Considering the many changes we want to make, it's important that we have an entire team behind initiating these changes, and this team needs to be around for the long run. In order to make this happen, we will implement an Office of Professional Oversight that'll oversee the new initiatives being implemented and ensure our goals are maintained moving forward. This office will not be built overnight, but will vet employees from different professions that are passionate about the initiatives we're trying to change and make. An interprofessional team is essential for this office because it needs to reflect the healthcare workplace, which is interprofessional in nature. Amidst hiring new employees to fix staffing shortages and relieve current employees who feel overworked and overburdened, we will have candidates for new roles be evaluated by an interprofessional team as well. By doing this, we will ensure that new employees meet our interprofessional values and that multiple individuals can analyze candidates from their different personal and career perspectives. By using an interprofessional team to implement our initiatives, we can ensure the changes we make are benefiting all our employees and future employees across our many departments.
How is your idea sustainable and scalable to other healthcare settings and organizations? We think that there should be willingness from everyone involved to actively participate for our interventions or idea to be successful and also sustainable and scalable to other healthcare settings and organizations. For that reason, we think that it is extremely important to educate others the rationale of the why. Why is it important to practice self-awareness? Why is it important to have awareness of my coworkers' needs? Why do we have biases? By understanding the rationale of the why, it establishes a personal connection to the cause that we're working on and will motivate us to be to actively participate and more involved. Secondly, the Office of Professional Oversight ensures that the interventions we implement and the culture we are trying to build is lasting. Having a designated personnel to oversee the outcome of our interventions is necessary for everyone to take it seriously and also to have a person to talk to if they have any questions, complaints, or concerns that needed to be addressed. Also, the Office of Professional Oversight will be able to keep track or gather data to show the positive or negative result of our intervention and if we need to adjust anything. When employees feel valued and not overworked, organizations run much more smoothly. As we have seen and experienced during the COVID-19 pandemic, some healthcare workers quit their jobs due to feeling undervalued and overworked. That's why we think that eliminating COVID-19 related stressor or burnout is key to prevent staff shortages and to increase productivity. Therefore, our interventions are focused on making sure the employees at every level are valued and the culture is one of inclusion.
Through this whole process of IPTS, our group really came to realize just how important effective communication is. We really began to realize how collaborating with different specialties and taking into account other people's ideas and perspectives really improves patient care and leads to better and more effective patient care. Through this case and the previous cases, we were kind of able to brainstorm and bounce ideas off of one another. We were able to challenge one another, and we were able to have open discussions where we would say, hey, I think this, what do you think? And we could really just collaborate with one another. We think that this is crucial because in the future, in all of our specialties and as we carry on in life, we are going to need the skills to collaborate and work with people who have different backgrounds or different ideas than us. So, this experience and working on this case together just really helped to kind of give us practice for those scenarios and to just show us that there are other perspectives and that, a doctor's perspective might be different from a pharmacist's perspective, which might be different from a therapist, which might be different from a nurse. And how do you take all of these perspectives and make them work in patient care and in the delivery of care? So, through this case, we have just learned that effective teamwork leads to improved communication with others. Equal collaboration and effort is absolutely imperative to efficiency. Effective teamwork leads to better and more effective patient care. And collaborating with different people and different specialties just creates a different perspective that you might have not thought of before. So yeah, I think that our group had great communication, great effort, and awesome and effective teamwork.